Knock, knock, knock. Hi, how are you doing today? Okay, okay, my name is Ariana, and I'll be here to do an assessment. What brings you today?
Just here for an assessment. I have to the doctor's appointment.
Okay, so can you please say your name?
Pain some poodles.
Date of birth?
June 688.
Where are we at?
We are at Susa Hospital.
Alright, so I'm gonna wash your hands.
Small painless nodule at the heels. This is a genital variation and it's not situated. Do I have one?
What is it called? Palpating. So now what is it called? Your temperature?
So 24, right?
Perfect. 38.3. Now I'm gonna check your blood pressure.
PUBER.
Yes, 120 over 80. Now I'm gonna check your pulse, respirations. Okay, pulse is 78. Respirations is 18. And then O2 is 98. Good to go. Are you in any pain?
No.
Okay, good. Okay, so now I'm gonna check and assess his cranial nerve 1, which is olfactory nerve. We're gonna check his smell.
Alcohol is right there.
Then you would say,
So, can you close your eyes? Let me know if you smell this. Okay, cranial number 1 is intact. And then I'm gonna check your nares. Okay, so your nares are bilateral and no deformities noted. Perfect. They're intact. Verbalized deformities by nerves is intact. Inspect the turbinates.
look at you guys, man. You guys all got it going on. And
Okay, I'm gonna have you put your head back. Closer.
Are you ready?
Perfect. So,
She's proud of those suckers. Look at her.
inspect the turbinates. Place one finger. Okay, so I'm gonna place one finger. Can you breathe in?
Me.
Okay, can you breathe? Can you breathe in? Okay, nares are
In it.
intact. Bilateral nose, inspect turbinates. Place one finger in nostrils. Breathe in.
And out to ensure patency.
Your nares are patent.
I think you're supposed to go like this, and they're supposed to breathe out.
Okay.
So do it on your own finger. You do it,
So,
and then do the other side.
nares are intact. They're patent. Good job. Turbinates are looking the same red. Yes, your turbinates are red. Nasal mucosa is moist. No tenderness or swelling noted.
This is the night pain.
Sit.
Oh, night pain.
Okay.
Almost remember the night.
I'm gonna have you.
Only when you're
Okay, so the mucosal membrane appears pink, no signs of sores, no discharge or exudate noted, integrity intact. The septum, no deviation noted, it's perfect. It is light red without any swelling or tenderness. No
Or exudate.
integrity deviations. Okay, so I do see hairs. They're really nice. It looks pink, moist, no discharge noted, no dry mucosa, no obstruction noted. You didn't stick anything up there, good job. So now I'm gonna palpate your sinuses. Do you feel anything? Is there any pain?
No, it feels
Right here.
good.
Hey, bro.
Nothing noted.
So he gets the color on his white shirts.
Okay. So he doesn't feel any pain. There is no tenderness.
Nicole, how close am I to the phone?
That close.
Skin color coming off.
Okay, good. So he doesn't have any
No pain or tenderness upon palpation of maxillary or frontal sinus.
Okay, so he verbalized the nice pain. There's no tenderness upon palpation of maxillary and frontal sinuses. Moving on to the next. Okay, can I have you open your mouth? Okay, can you close your mouth? So when he opens and closes his mouth, the lips are closed and they're symmetrical. Do you have any dentures? Lips are moist, normal in color. There's no lumps, cracking, or scaling. there's no lumps. Nope.
UMS.
So lips are intact. There's no lesions or sores or bumps. Okay, so you can only palpate. Oh, okay.
Okay, test
So you only palpate when you see any lesions.
Sores or bumps.
Next, I'm gonna view your buccal mucosa by pulling down the lips
Otoscope, and you actually
and
have,
verbalize.
like you said, hand conditioning is what they're looking for.
I don't see anything. They're healthy. Okay, so now I'm gonna have you open your mouth and I will inspect your ducts.
And you're gonna
Oh, I
hold
have to
their
put
head still so that you don't jam it in.
No.
And
Okay, just open.
your hand is protecting. See?
Yeah.
I rest it. Pretend
So yes, oh boy, I'm sorry.
So we're not going to check it back?
then I would do this like this. So like
Okay,
this.
so stentus is intact
Back,
and everything's normal.
resting.
The second molar.
And it's by the second molar. The teeth. Let me see.
Right, so if she moves, my hand's gonna use
Open
her.
I have a mouth dent.
It's okay. Okay, now bite down.
That's how I try to close my kids, is pulling by the
Yes. So alignment is intact. Upper teeth slightly over by the bottom.
upside down, so like if I'm
They're
going
pearly
down
white.
left
Condition
ear,
is well.
left hand.
Proper oral hygiene. Teeth are intact.
Pretend I have the
How many times do you brush your teeth?
I'm gonna put my
3
hand there
times.
and I'm gonna pull back.
And how many times do you floss? Excellent. Okay. Here comes your pink. No lesions noted. No swelling noted. Now I'm going to access your tongue.
Tilt their head and
So you can prepared.
up on the nose.
So, can I see your tongue?
I think that was for.
Okay. So the tongue is smooth. No lesions noted. Very small features, pink, reddish, and free of lesions. Now I'm gonna
Oh, no, it says over here.
with the gauze pad.
Ask if they have any dryness or tremors.
Put it, the finger.
Verbalize if you
If
fall.
you okay,
Okay.
so with gauze pads, you will hold the patient's tongue down and palpate the floor. Okay. So, how do I do that?
You need gauze.
Where do I get the gauze?
No,
Just
acoustic.
pretend.
Okay, so I'm just gonna palpate the.
Acoustic now.
So with gauze pads, you would hold the patient's tongue to one side and palpate the floor of the mouth and should not feel any lumps or indurations.
I'm just gonna do that. There's nothing there. All right, there's no lumps or indurations. Now I'm gonna view the Warren's duct. Underneath the tongue, you can put your tongue up. Okay, there is Wharton's duct. Everything's normal, no lumps or lesions noted. Frenulum.
Frenulum.
Frenulum. Verbalize the connector under the tongue called frenulum. That stays intact midline. Can you
Lift
please
up your
stick
tongue.
head tongue? Frenulum is intact and symmetrical. There's no lumps and lesions or abnormalities. Okay, I'm gonna use it, and it's pink and I see visible veins. So I'm gonna test your cranial number 12 hypoglossal nerve using it. Okay, so I'm gonna place it on one side of your tongue. I need you to move it to that
Stick your
side.
tongue out. Yes.
Okay, push that way. Yes. Yes, it is strong. So cranial nerve number 12, hypoglossal nerve is intact. Pressure is equal on both sides. Now, do you have any trouble tasting anything lately?
No.
Okay. Cranial number nerves, 7. Facial nerve, 2/3 of tongue is intact. And cranial nerve number 9 is intact. Glossopharyngeal posterior. So that's good. So, I'm going to have you open your mouth and tilt your head. So soft.
So open and tilt your head back.
Okay, the palate is pink.
And soft
Soft,
palate.
muscular. There's no abnormalities noted. Oh my god, I want to make you gag. Just pretend to gag. Yes, I love it. Cranial number 10, vagus nerve is intact. So, back patient, you gag. Okay, so inspect the uvula. Open up. The uvula is centered.
You're supposed to put the depressor on the tongue to inspect the uvula.
Stick the tongue
Stick your
out.
tongue out.
Stick
out.
it out. Okay.
Open wider.
Yes, the pupil is symmetrical.
He's like, I don't gag.
And say ah. Okay, you're supposed to say ah. Yes, it's midline position, and in pharynx, the tonsils are smooth and pink, and your uvula is +2 visible. You can +2 visible, and pillars are pharyngeal as well. So I find no abnormal hard palate. Inspect the palate. No abnormal findings. Okay, let me see. Open up. All right. The hard palate noted. There should be, yes, I see a bony, whitish, bony pubescence. It's pink, no sign of inflammation, pharyngeal wall. It's pink, and there's no inflammation, no signs or symptoms of any lesions.
That's it.
That's it.